Hi, I'm Dr. Seth Hosmer. I'm here at Hosmer Chiropractic Health, and what I wanted to talk about today was teaching you to do some self-treatment techniques for the muscles that run right along your hip. A lot of people are familiar with doing either a lacrosse ball or a trigger point ball for the muscles in the back of the hip, but they don't do as much with the side of the hip. And there's a new product that we like to use that does a much better job, especially with the side of the hip, in releasing the muscles in through there. So most people are familiar with either using one of these type of products, a roller for the hip, which is good global pressure, or either a trigger point ball or a lacrosse ball for working on those muscles. But one of the new products that we're using a lot in the clinic and have found especially helpful is this one right here, which is the Supernova. We call it the Death Star. It is especially good at releasing the tension in your hips from about here all the way around to the side. And previously, one of the real challenges for us helping patients was figuring out a way to really get enough pressure and stretch on the muscles in the side of the hip in order to really get those tissues to loosen up. And in a lot of our cyclists, runners, people that sit at a desk a lot, these muscles are super tight and we just have had a difficult time getting them to let go. And this causes all kinds of issues with the pelvis and into the low back. So we're gonna show you a strategy today for using the ball here to take care of this. So looking at the spine here, where we want to start out with this ball positioned is in the back of the hip, kind of high and in the middle, and then we're going to progress around keeping it kind of high all the way around the hip and over to the side. So in practice, how this is going to work is we're going to have you lay on the ground, position the ball high and in the middle of the hip, and then we're going to work so that it moves over to the side. So let's go ahead and set this up. So we'll start out laying on your back, roll over to the side, and we're going to position the ball like I showed you in the back of the hip here. I'm going to roll back over on top of the ball so I've got my hips balanced over the ball, and then I want to keep my right leg straight and my left leg is bent. This left leg is going to help me control the amount of pressure that I'm going to get on the ball, as well as help me direct movement so that I feel stable on top of the ball. And what we want to do in this first position is to establish a baseline pain-free spot. So a little bit easier said than done initially, because for most people this spot is still fairly sore, but we're not going to have any luck getting the outside of the hip to release until we've gotten a spot on the back of the hip that's relatively easier to release. We need that basic point that's more or less pain-free so we have something to work away from. So if this point here is too sore, what you're going to want to do to ease into it is to take some of the weight off with your left leg. You can take some of your weight off using that other leg and then slowly lower back down on top of the ball so you feel like you're getting a good relaxation in the muscle without it feeling like it has to tense up. It might take as much as 2 or 3 minutes for that spot to release that you're starting on, but once you feel like that does soften up, we're going to think about taking the hips and turning them a little bit to the side so that we trap a little bit more muscle that has not been treated yet. So I'm going to rotate a little bit to the right. As soon as I feel that stretch or that pressure ramp up, then I've got my new point that I'm going to treat, and I'm going to stay on that point until I feel that release. Then I'm going to gradually continue working around to the side of the hip. Eventually I'm going to turn so that I'm actually laying on my side. And then ultimately I'm going to work around to where I'm treating the front of the hip in the front pants pocket region. In this way we can get the whole hip to let go, but keep your expectations in check, because the back of the hip and sort of the first third is probably the easiest part. And as you're trying to transition from being more or less on the back of the hip to over on the side, it's a lot harder to work through there. So it's going to take probably a couple of weeks of doing, spending at least 10 minutes on either side of your hip to get this to let go. But it's definitely worth it, because after you spent a good amount of time on this, it's going to really change the way that your hips function and really help you achieve the flexibility goals that many of us have for the hips. You just can't get to where you want to be with hip flexibility and kind of curing the Western hips without releasing the lateral side of your hip. So This will be your best friend and worst enemy, but it will help you get to where you want to be with hip flexibility.